The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon. Welcome to the County Health Rankings and Roadmaps Partnership Series webinar, Partnering with Education, Next Generation Thinking. This webinar is being recorded and will be posted on our site later this week. We've posted a link to the slides in the chat box, and we'll also send a link to, and we did send a link to all participants before the webinar. My name is Jan O'Neill, and I'm a community coach with the County Health Roadmaps Project. My colleague, Karen Odegaard, is with me to assist with questions. Why are we focusing on education as a key partner? Well, research shows that educational attainment is one of the strongest predictors of individual and community health. Education levels influence income potential and job type, access to healthy food and health care, and individual health behavior choices. At the community level, public school achievement outcomes influence local economic health. So we're pleased to be joined by Kimberly Klint, Executive Director of Mason Matters, which is located in rural Shelton, Washington. Mason Matters is one of 30 communities awarded 2-year grants by Robert Wood Johnson Foundation to support creation of positive policy or systems changes that address the social and economic factors that impact the health of people in their community. And one of the many successful initiatives that Mason Matters is involved in is their partnership with local school systems to improve high school graduation rates. We'll be interviewing Kim in a few minutes to find out how Mason Matters, by building relationships between schools and businesses, is beginning to change the culture of this traditional logging community to support higher education aspirations. So first, a word from our sponsor. The County Health Rankings and Roadmaps program is the result of the contributions of many partners, including the Robert Wood Johnson Foundation and our colleagues here at the University of Wisconsin Population Health Institute, and the various partners who help us compile the rankings data and get the message out about rankings and roadmaps. And we want to take a moment to get you oriented to the technology we're using today. The GoToWebinar attendee interface is made up of 2 parts. On the left, you can see the viewer window, on which you'll see my screen throughout the presentation. And on the right, you can see the control panel, which is where you can interact with us. Because of the number of people we have on today's webinar, we'll be taking questions via the control panel. So please feel free to enter your questions in the control panel at any time, and we will answer them toward the end of the webinar. Here's a quick outline of what we're going to be talking about today. We're going to start with an overview of the County Health Rankings and Roadmaps program, and for those of you new to our program and site. But for those of you that are familiar with our program, Karen is going to be posting links for you to explore throughout the entire webinar, but especially during this part of the webinar. So feel free to go out and take a look at those links. Just click on those. Next, after the overview, we'll interview Kim to find out how Mason Matters is partnering with local schools. Karen will post links to Mason Matters during that time, and then we'll open it up to Q&A. After Q&A, we'll show you where you can find guidance and tools on our website, and we'll focus on one tool in particular, the County Health Calculator, that can help you talk with education and business leaders about the link between health, income, and education. And then finally, we'll close with some final thoughts. So again, if you at any time you have a question or comment, please be sure to write to us in the question box or raise your hand or just chat to us. And as far as the goals for today's webinar, based on your pre-registration questions, we believe that these goals, which I'll go through right now, will get at much of what you told us you were interested in learning more about. So by the end of this webinar, we're hoping that you'll understand how to build common ground with educators. And secondly, understand how to move from common ground to a true partnership that leads to policy and systems changes. And finally, that you'll understand how to help business and education partners make the connection between education, employment, and health. So now we're going to put up a quick poll to see where you are with partnering with the education sector in your community. And Karen's going to post that right now. And we'll just give you a few moments to let us know where you're at with the education sector where you live. And we've got about 65% of you. Get a little bit more. And great. All right, we're going to stop the poll, and let's see where we're at. Okay, great. So what we're seeing is that what's wonderful about this is that 40% of you are at that networking stage, which is certainly foundational to moving change in a substantive way along. You've got to be able to have information about each other, so that's really, really important. I'm also, we hear a lot as community coaches about the amount of parallel play that goes on, so that's probably not a surprise. And if you are doing isolated silos, know that you're not alone. Okay, great.
One of the things that we encourage you to do is, especially those of you who are really out there collaborating with educators or getting toward that, coordinating, collaborating, please feel free to add your own insights and your own thoughts about what has been successful in your community in that question chat box. And we'll, as it's appropriate, we'll definitely share those with others. I think it's helpful for people to learn from one another
Right.
on the webinars.
And one of the things we've learned coming out of these webinars, too, is this is a great opportunity to connect you with each other out there. So feel free to let us know if you'd like to be connected to others, and we will do our very best to play matchmaker. So that's one of our roles. That's great. All right. So we always design these webinars with an essential question that sort of drives the framework for the webinar. And today's essential question is, how can we build true partnerships with the education sector that will lead to policy and systems change? So next we're going to do a brief overview of the Rankings and Roadmaps program. And again, feel free to pursue the links that Karen will be posting if you already know this part of our webinars. We use this logic model to explain why we create the rankings. Our goal is to create a healthier nation, county by county, and we do this by ranking the health of every county in every state. We keep the number of measures small for the rankings. They are ones that every county uses and ones that already exist. We release the rankings every year. This 2013 was the 4th year we've released the rankings. And it's always in the spring and in March around that time, and it always attracts a lot of media attention both locally and nationally, which gives you as community leaders an opportunity to use that as a lever to engage your communities in action that will improve health. And the bottom line at the end of the day is, why do we rank? It's really all about a call to action. So for each county, there are 2 rankings. You get one for health outcomes and one for health factors. And that's because there's 2 separate sets of messages we want to convey. One is today's health, how healthy your county currently is. And the second one is tomorrow's health, how healthy your county could be in the future based on the many factors that influence health. So let's take a look at those many factors. This is the model underpinning rankings, and the main message is that health is the result of much more than visiting a doctor's office. It's about where you live, learn, work, and play. So starting from the bottom, we believe that effective local, state, and federal policies and programs that can improve a variety of factors that in turn shape the health of communities, and many health factors shape our communities' health outcomes. So we specifically look at health behaviors, clinical care, social and economic factors, and the physical environment. And each of these has a different amount of impact on health outcomes. For example, with social and economic factors, which includes education, they contribute as much as 40% to how healthy a community is, which sort of connects the dots for business leaders and educators and citizens about why are we investing in education, why are we investing in employment. It's because we want to increase the length of life and the quality of life of people in our community, not just for today, but for our children. So finally, at the top of the model is health outcomes, which we measure as how long people live, mortality, and how healthy people feel, morbidity. So all the blue was the tomorrow's health, and the green is today's health in the terms that I used prior. So this next slide is the home page for rankings, and if you clicked on the Roadmaps tab on the right-hand side, you'd find our Action Center, because it's all about taking action in your community. And the Action Center provides a variety of tools and guidance to assist you in taking action, including what works for health, which is a database of close to 200 evidence-informed policies and programs to choose from. And if we take a further look into the Action Center itself, you can click on any step in the Take Action cycle to find guidance and tools for the various activities that make up that step. So, for example, if you're finding yourself working in isolated silos, we've got lots of great tools around work together for what to do to start to create more networking and more true collaboration in your community. That's just one example. In What Works for Health, which is the next slide, what you'll see is that we search out and summarize and rate evidence for policies and programs that can affect health. And we also provide examples of communities that have implemented these strategies, along with links to toolkits and other items to help you get started. We also have a county health calculator on our site, which can help you see the impact of investing in education and employment in your county. We're going to be looking at this in more detail at the end of this webinar, so I'm not going to go into detail here, but Karen has put the link in, and you can look at that if you like. And then also, thanks to the support of the Robert Wood Johnson Foundation, we have 3 community coaches in the program, and our assistance is at no cost to you. We're available to consult with you on how best to move action forward in your community. So at this point, we'd like to do another quick poll to see which parts of our program you've used, and Karen's going to launch that right now. And this is one of those where you can answer more than one. So we'll give you a little bit more time. Okay. You've got about a little over 60% of you. I want to give you a little more time to answer this. And it looks like we're good. Okay, so let's take a look at the results. All right, we've got a third, with 65% of you voting. So it looks like about a third of you have been using our activity guides and tools. And if you have any feedback on those, we are constantly in a revision, continuous improvement mode. Great. Wow, third have used the calculator. That's great. Now, as far as contacting us, you will see on our site, you can, at that orange little button there where it says Get Help, this is on the slide. Anytime, feel free that you can just email us a question, and we really do try to get back within 24 hours, and whatever the question might be. So we want to encourage you on this webinar to make use of that, if you need to. Great. Any other comments about this? This is helpful information. So now we know kind of where you're at, and when we go to the calculator at the end, we'll know that about a third of you have been using that. If you could, if you're on the webinar and we're going through the calculator, just let us know what some of your experiences have been with that. How have you used it? What's the impact been? But we'll hold that until the end of the webinar. Great. Thank you all very much. So next, I'd like to introduce Kimberly Klint, and Kim honed her skills as a community mobilizer when she served as a faculty member with Brock University's Health Studies program. She earned her PhD in Social Psychology of Sport from the University of Oregon in 1988. She has served as the Executive Director of Mason Matters since the year 2000, and Mason Matters received a Roadmaps to Health community grant from the County Health Rankings and Roadmaps program in 2012. Mason County is in the Olympic Peninsula of Washington, one of my most favorite places in the country, just gorgeous. So welcome, Kim. Thank you for joining us. Could you tell us a little about Mason County, Washington and Mason Matters?
Sure. Well, first, thank you for the opportunity to share some of our community story here. give a quick tour of our community. As mentioned, we are a rural community. We capture the tail ends of the Hood Canal there, that big U shape, and the south sweep of the South Puget Sound. And as you can imagine, because of our physical environment, it kind of shapes who we are. We have a very large seasonal community who enjoy vacation homes and all that glorious water there. And because of our lower housing costs, we actually serve as a bedroom community to our neighboring counties that have a lot more job opportunities. That's Kitsap to the north and Thurston County to the south there. And these realities do impact how we have to approach our community engagement strategies, and I'll talk more about that later. Historically, we've been a resource-based economy dependent on timber and shellfish industry, and they're still critical parts of our local economy. But like many rural counties throughout the nation, government is the largest employment factor. And with the fall of the timber industry in the late 1800s, creating employment with living wage jobs has been a real issue. I tell people, to give us sense of the scope of the issue, our single Walmart store has been our largest employer in our county, and now our Indian casino and resort is. Because of our history of jobs in the timber industry, we don't have a strong college-going culture in our community, and with the loss of those jobs and growth in sort of the service industries, we're really seeing a huge increase in poverty. Currently, 22% of our kids live in poverty, and over 15% live in extreme poverty. And we're starting to experience many of our cycles not moving into that second and third generation of cycle of generational poverty. So that's let you guys flip to the next slide there. So I guess to highlight how rural we are, our population of just over 60,000 people, we only have one incorporated entity. That's the city of Shelton, and that has a population of 9,000 people, and everybody else lives in unincorporated Mason County. And since the majority of our population live in an unincorporated area, that's where most of our school districts are. We have an interesting structure here. We have 7 independent school districts spread throughout the community. Of those 7 school districts, 3 are K-12, but I'll highlight that Merriam Knight with 176 kids is a K-12 standalone school located in very, very rural Mason County. The other 4 school districts are K-8s, and with the kids transferred in, and I'm using rabbit ears here, transferring into the big city high school of the city of Shelton. And this, when we're doing the work we've been doing with our education partners, also presents some very interesting challenges, because each of these school districts maintain their own independence, but the students are moving across and between school districts over the course of their time. So a little bit of history real quick about Mason Matters. As mentioned, we're a nonprofit organization dedicated to improving the health and quality of life in Mason County. We're established way back in 1999, and the wonderful thing is that we've received consistent operational funding from both our Public Hospital District No. 1 and Public Health Department. And what that means is the resources, i.e. my time, is really totally dedicated to the community mobilization and community improvement activities that we do. We focus on community-driven priorities. We move where the community is and not where our funders are. And we've always brought in the social determinants of health model to guide our work, but we've recently adopted the Robert Wood Johnson languaging, is that we are improving health where we live, learn, work, and play, and that resonates well with our community. So in terms of Mason County's health, when the county health rankings first came out, we were 37th out of 39, so I say that means we have a lot of opportunities for improvement, and we've made steady improvements, and now we sit at 33rd position on the 2013 report. Just as a note, we meet none of the national benchmarks on any of the indicators, so we again have lots of opportunities for action in our community. In our community, like many other communities, we've just completed our community health improvement planning process, driven by public health accreditation needs. And our community, not surprising when you look at some of these numbers, as a community process to improve health improvement, our community identified trained and prepared workforce with living wage jobs as the top strategic health priority if we wanted to get significant and meaningful increases in the health status of our community. Our strategic health plan around this top priority is we're really actually taking a cradle to career approach to this, so it's just not about the adults in our current workforce and getting them skilled and trained up for the jobs that are out there, but we realize we need to be investing as far back as early learning. So our strategic health priority is on that continuum from early learning to adults. That's about Mason County.
Yeah, that's really helpful. So that sort of sets the table for us, Kim, for this question about why are you focusing on educational attainment? Why this issue? Why now?
I think you talked about it earlier, is that the research shows is that education attainment is one of the strongest predictors of both individual and community health. And particularly in our community with not having such a robust economy, that that connection between health and the potential economic, maintaining the economic and building the economic growth of our community is absolutely critical. We have been doing a lot of work since 2004 on focusing on high school graduation and have made significant increases countywide in that area. But what we realized was when we were actually writing our Robert Wood Johnson grant is that we actually set our focus too short-sighted. We were focusing on high school graduation, but the indicators suggested our graduates were not thinking about the beyond part of graduation. And so really what this project is doing is shifting to that beyond conversation and really thinking about this as career and college readiness priorities in our community. And obviously the Roadmaps grant that we've been awarded has been really a perfect opportunity for us to expand the work we've been doing around education since 2004.
Great, and you know, I know that what you did here in this slide, thank you very much for connecting all the dots from, you know, laying all the groundwork. So here's the heart of the question. The next question is, how have you built relationships with the schools? What does that process look like over time?
So we started our work with our schools in 2004 with an initiative that we call our Student Success Initiative, again reminding that the main focus was on high school graduation. And at that time we realized that many of our kids were not coming to school every day ready to learn, and it wasn't because of academic needs, it's basically because their backpacks were full of unmet needs like unstable housing, food instability, family dysfunction, and this was a huge community priority at that time. We knew that it had a connection to how well kids were achieving in school, so what we started to do was making connection with our schools to be able to say, if we can help build a structure and a system so we can help support as community address these non-academic barriers, then you're going to have more kids sitting in the seats ready to learn. And that's how we forged the partnership, as trying to find that what that common goal was, which was obviously student success, and figuring out how we could reframe our investments and connections around this student-oriented focus. So we really started by, again, trying to understand what the needs of the schools were. Our schools were under pressure from their achievement scores. We had a lot of schools failing under the No Child Left Behind. Businesses and community were looking at that and frustrated that the schools weren't doing their job, and so we figured out how we could frame some efforts so that really was around an academic, that we were working together toward this academic goal, but we weren't stepping on the toes of the teachers and the professionals that were taking care of the academic ease. So we took the lead, and this has been sort of the consistent learning lesson that I have is, and we translated all of our work into education-ese. So we learned if they were being tested on GLEs, and don't ask me now what GLEs mean at this time, but the assessment was on GLEs. We actually used the same measurement tools, such as the GLEs and other tools, as a way to measure our work. So, so that was one way we were able to partner and be in the same place where the schools were. And we also were then invited to any support meetings around kids that were at risk to be able to be part of that problem-solving team, because these schools realized that it wasn't just an academic, but you also needed that non-academic partner at the table there. We also built our relationships, because I have 7 school superintendents, and originally when we got our grant, we actually deliberately scheduled our Student Success Consortium immediately after the monthly countywide superintendent meeting, and we're able then to invite the superintendents, since they were already in town for one meeting, to be able to join, to extend their day at another meeting. And that really helped build relationships with the superintendents, so they could kind of hear how their non-academic partners were talking about the issues, and realizing that we were actually all on the same page around wanting the best for our community's youth. And the other piece that I did is we had one long-standing superintendent. One of the things in rural school districts is that you have a very high turnover of superintendents. But we did have one long-standing superintendent, and ever from the beginning, 2004, she and I would meet for lunch and just have a review of our year, and it was a real opportunity for me to hear what were the budget, what was the impact of state budget on the work that they had to do, what were the new issues that were coming down with regulations or requirements from both the federal and state level. And then I could take that information over the summer and figure out how we could reorganize and reframe the community work, so that when we came together, when school started again, we were back together on the same page. And I'd like to mention that this whole idea about building the credibility and relationships with the superintendents has been really important. Because of the high turnover, I can't afford to sort of reestablish and go back and build relationships with new superintendents, because if they don't have that history. So we really had the longer serving superintendents help open the door and establish that credibility, so we've been able to keep our work moving forward. And how I saw that investment pay off is actually when our Roadmaps grant proposal was due on July 15th. I had 2 brand new superintendents come in the door July 1st who did not know me from Boo, but I was able to partner with my other superintendents and help messaging and get them to agree to sign off on the grant when they really didn't know me or didn't know my history or didn't know my work. So that's how I see some of that relationship building really benefiting us.
So yeah, relationships, and you're speaking the language that is the language of educators. So how are you currently working together?
So with this, our Roadmaps grant, which we titled High School Graduation and Beyond, what I realized is that my challenge is, as the public health person here, is to be able to translate my public health agenda, and my public health agenda is improving the health status of our community, and develop a work plan, in this case having to translate and build a work plan that's in public schoolese. And because it's so important with our business partners, I've also had to do a pivot on that same work, so it's also being translated into workforce development. So as I say, my public health agenda is improving the health status of our community. When we talked with our employers as a starting place, our employers actually have, our employment base actually has a lot of jobs. It's just that the people that live in Mason County aren't skilled for those jobs and can't compete for them. And in the conversations, I think all of us have heard in talking with our employers, they're really frustrated with the public school systems because they believe that the kids are not coming out with the really critical thinking skills and what we've now called the ability to deal with the messy problems because of the complexity of work in the real force. So sort of remembering that need from my my employers talking about the future workforces, then I connected up with our public school people. So I'll click on the next dot there. And realizing, so now all of our schools, and I believe probably all of your school partners, are so focused on Common Core and shifting to these new Common Core state standards. And so I really trained myself into Common Core to really understand what's going on. And what I saw there as part of Common Core was this shift for being able to measure and assess what they call the integration and application. And that shift of integration and application started to feel like getting to some of those critical thinking skills. But in conversations with actually more than one of my school superintendents, when we were building this grant, they said, we know the businesses in general community is sometimes frustrated with us for not producing kids who can apply their work, but they said, and this wasn't a real aha moment for me, they said, you have to remember, our staff went to school, graduated from high school, went to school, graduated from university, come back to school where they work, and go back to school for their professional development. They don't all necessarily have this deep and rich set of experiences to build this application and integration piece on that our businesses are responding to. So the next piece in pulling these together was then rethinking and going back to our business community, who they realized their future economy, you can pop up the next bubble there, their future is that having schools that are successful is going to help them recruit the professionals that they need, and that their schools also wanted to have connection with the schools, but they kind of didn't know how to do that. An average business person doesn't know what a fourth grader is learning in math, as an example. But really what the businesses had is they were the experts in the messy problems that were out there. So what we realized is that the sweet spot on this particular initiative is looking at that place where if we could figure out a way to create space in the school structures and have the schools prepared and have our businesses partners prepared, we could have a partnership where businesses are able to come into the classroom in the right places, paced within the right places of school curriculum to really add meaningful and relevant engagement that really addresses the critical thinking skills that the businesses wanted. So that's how we've started to do this, and a large part is I'm trying to kind of think here, and how we've kind of built this structure up is we are producing what I call the world of work, the work that keeps Mason County operating, messy problems, and we have developed over the course of the summer, working with the groups of teachers across the county, Common Core informed application problems that are built on the messy problems that keep Mason County working. And my challenge to the school teachers is when they're teaching a concept, they can either go to that word problem in their textbook, and no offense to Texas, but our textbooks tend to be written in Texas. They have no relevance to the kids in this community. So what we're building is this repertoire of applied problems for the youth to solve, and those applied problems are relevant because they're the jobs in our community, and they're starting to connect the youth to the job opportunities that are available in our community.
And Kim, can you give us a specific example where you've been able to move from into that true partnership that you're talking about here? It's a curriculum partnership with teachers and administrators, and then how you've moved that into policy change?
So we're early, and we're not even year one into our Robert Wood Johnson grant, so right now my examples are a little bit limited. But for me, one of the more exciting ones is, as I say, so I'm the one that holds the public health agenda, and I'm the one that's pivoting the conversations to whatever partners I'm working with at that time, so they're actually hearing and seeing the work relative to what their priorities are. So I mentioned I had been working with the teachers this summer working on curriculum, and one of our curriculum is whether it's from school lunch meals to our hospital feeding and our nursing homes feeding people. They all have a similar messy problem of being able to feed people healthy foods within government restrictions and hitting a price point. So that was one of our messy problems that we were working on. So we were working through the teachers developing this curriculum, and I had an opportunity to share about how school meal programs and these kind of light bulbs were going off. And the teachers at the end of that, you know, we're going like, well, it's no wonder what the schools are feeding the kids what they are. It's impossible to feed kids healthy foods on whatever $2.20 it is a meal and still have it meet the kid-friendly criteria as well. So as part of these messy problems, we're doing a follow-up activity on every one of them. So their question to me was, well, who influences this policy? So I kind of explained it happened at the federal level. So they are committed of having the kids, once they've worked through the messy problems of the meal program at their school, if they can't figure out a way to do meals that meet all the requirements, their follow-up activity is having the youth write to our federal representatives and talk about how difficult it is, and they will share their math on how difficult it is to feed kids healthy foods on the school meal reimbursement schedule. And so for me, as a public health person, that was really exciting to have public health action happening really at the community level. I think a better place, another example that we have on this policy change is we had included some professional development in our grant work plan, and we were to fund a one-time opportunity, and I've been able to leverage some additional resources. So we're putting on this Bridge to Prosperity Community Learning Institute, with some part of that being the teachers getting some education and our community also concurrently getting some education. But I've been able to leverage the Robert Wood Johnson Foundation funds with our community foundation funds. So our training, professional training for our teachers is a work with Drs. Kathleen Budge and Bill Parrott, and they're going to be bringing their turning high poverty schools into high performance schools framework to our community. But the exciting thing where we're starting to do the policy and system change with the leverage money, we are actually going to have Bill and Kathy in our community for 2 years. So it's not a one-off training. Teachers go back to your very busy schedules with the book and implement these system changes. We are going to have all 7 of our school districts engaged in a 2-year coaching relationship so that this work gets embedded in the culture and institutions of the schools. So we'll be able to monitor that impact over the next couple of years.
These are great examples. I know you've got more, but for purposes of time, let's move into how you have helped the business community make connection very specifically. How are you pitching it to them?
So for the business community, I'm pitching this totally as a workforce development issue. I'm letting them know if they are struggling to find the trained and prepared workforce that they need from our local workforce here. The reality, and many of them have many baby boomers and people that have postponed retirement, and so there's a lot of concerns about who's going to be filling those jobs in the future. And since we're all small community, small business, their priority would be to hire local people because local people spend their taxpayer dollars here. They support our schools. They support our service groups. They use our local healthcare system. So they are really invested. So my comments to them is that your future workforce is sitting in the classrooms right now. And unless we let our youth know about the great job opportunities are here and the various career paths that they need in order to prepare themselves for the job opportunities, we're going to be getting the same same that we have. So we've been able to we're launching it next week. It's the My Dream, My Plan, We Can Do It campaign, and it is really about messaging to our youth about dreaming and in being able to consider in those dreams that there's a future, there are opportunities here in Mesa County to be learning more about how to plan for those. And then the most important part, what is the place for the we, whether it's businesses, community, other service groups, what roles can we come in and support our students, whether it's in school or out of school, support them in their dreaming and support them on their plans, so we are all together building the workforce that we need to keep our community healthy and moving forward.
You're so good at framing things for people in their own language. And
Yeah.
that's really great. That's a great lesson. So let's actually wrap this up with some of the lessons that you've learned from your work with Mason Matters in working with education and business partners. What are some of your lessons?
So I guess one of them is really recognizing that our school partners do have an inward and focused agenda that's really driven by factors outside the community, state and federal regulations. So it really starts by listening for and understanding the challenges of your community, your education partners' needs. And really, then the next piece of that is getting yourself versed in that language and then being that pivot point to figure out, so where's the overlap between my public health agenda and the school agenda? And I am the one that takes the lead. I think we talked earlier about it's like visiting a foreign country. I'm the one that learns the language and does the translation, so that I really don't expect, but I'm thrilled when it happens that my school employees, my school partners are not necessarily also having to learn my language. Eventually we get there, but it's not where I start. So we're really starting on a pivot point. We also, in our case with the 2004, when we started with schools, we started with a give and not an ask to start the relationships. We had resources to bring to the table. We really didn't ask anything from our school partners, but we gave that give as a way to help them address an issue that they didn't have the resources available. And then the last piece of that and it's really critical in rural communities, is it's all about relationship building. And that is really a long-term engagement. It's not just about the times when you're on task in a meeting focusing on that. One of the advantages of being in a rural community is that the people that I partner, I see them at the gym, I see them in line at the post office. We have able to share a little bit of our personal lives too, and to me that continuous building on relationships at multiple levels has really helped us keep the initiatives moving forward even as the partners at the table have changed.
Oh, this is really fantastic. Thank you so much. I know we didn't give you much time, but we do want to open it up now to questions from our audience. And Karen has some questions ready for us. We also, somewhere along the line in here, there's, I believe Michael has something to share about working with universities.
Yeah, well, this is a great example of our audience asking a question and then our audience answering the question.
Yeah.
So somebody has asked about, what kind of role can colleges and universities play in this partnering with education piece? And separately, Michael was sharing an experience that they have had in Northeast Ohio and saying that, and I had asked him what was one of the biggest tips that he might have for making that connection. And what he said is they were able to link up with a faculty member, and he suggests, find a faculty member or a department that does a lot of outreach or needs students to volunteer and engage with them. Invite them to your meetings, go to theirs. I always think that's a really important point, is to, not just invite people to your table, but go to theirs. Have joint meetings and bring them along to some of your initiatives. In his experience, it's really been as simple as starting the conversation. And generally, the folks that he's worked with have been more than willing to help and become active in the work that they're doing. Mm-hmm. So, it's so often the key with partnerships is just to, again, start that relationship. Go and make the effort, give something if you can, or engage them, make an ask, whatever. Just make the attempt. Get out there and build that relationship.
So this is Kim here, and that kind of does remind me when I was thinking about that. So because we were having teachers this summer developing this curriculum, and Common Core is actually the shift that all the teachers are doing, I actually went to the teacher education program at the university in our neighboring county and made it and opened it for member students who are graduating from the Master's in Teaching program actually to come join us, and I had 3 teachers from that program come and also get their hands mucky in the Common Core. And in planning that meeting, there was a sit-down meeting with 4 of the faculty, talked about this initiative, and they are actually going to be helping us on the evaluation piece for next year.
Oh, that's
Again,
a great example.
started with a give and an opportunity, yeah. And then you get gifts back.
Absolutely, right. Another question do we have from? Well, I think one of the questions that came up was, building successful partnerships and being a resource and not a burden, and I think you've really answered that well. There's another question that folks had, which is how do you get parents to pay attention so that they're the health promoters themselves? So really it's about parent engagement as well, which these are the same folks you're running into at the grocery store,
right? And
your friends down the road. So how did you do that?
So some of that's in our year 2 plan, so we haven't started that, but part of our plans are, as an example, in the state of Washington, we're really lucky we have an initiative called the College Bound Scholarship Initiative, and what that is that students who are low income, and that can be included on free and reduced lunch or on Medicaid insurance coverage or eligibility requirements for this program. At 7th and 8th grades, if their parents enroll them in that scholarship and those students graduate on time and don't get in trouble with the law, they actually get scholarships to any one of the 63 higher education institutes in the state of Washington. But that work has to happen at 7th and 8th grades, long before kids are thinking about careers, so we know we need to get attention of the parents. What our strategy is, we are actually going to be working next year with the College Bound staffing, and we're actually going to be making age-appropriate College Bound awareness materials that will be handed out when the parents are in WIC. And we're partnering with our pediatricians' offices because they know what insurance people have. So our goal is to get some of this messaging and exposure to the opportunities way, way earlier. So by the time the family hits the school system and they're getting this message home about this College Bound scholarship next Friday, that the family and parents will have some context, and they're getting the information from maybe community people that are providing services that they have a different level of trust relationship, and we're hoping that will kind of help push. We're also talking about, because we partner so well with our hospital district, all of our college and career readiness messages are going to be in every pediatrician office. Our goal is when our pediatricians get onto their electronic records that they can also be including that in some of their conversation.
So a quick question here is, are you describing, is this AVID?
No.
One of the, no, yeah, okay.
Yeah. No, AVID is no, we don't have AVID in our county.
Okay, all right. That's one of those, quote, well, it's been research-based, there's some evidence of effectiveness, but you're describing something different.
Correct. And the reason we don't have AVID is our schools can't afford AVID, the cost associated with that. So we, because of the budgets of our school districts,
right.
we're moving where we are.
Right. And you started talking about partnerships with pediatricians. Can you describe some other partnerships you have, maybe with out-of-school time providers, and I don't know if you partner with recreation, YMCA. What kinds of other organizations do you partner with?
Well, we are partnering, and we're a little limited on what our out-of-school activities are. This year we partnered with our 4-H, and they are moving toward a STEM program, so all the messy curriculum math work, the kids will also be exposed to that in their out-of-school 4-H curriculum, so they'll get exposed to it more than once and hopefully see some connections that way. We do have a Boys and Girls Club, so they're going to be part of our Dream It campaign. So out of school, some of those same activities that the youth are doing. Where it's kind of interesting, we have a program called YES, Youth Empowerment Strategies, that provide services for our at-risk kids. So as part of our launching campaign, those youth have been working over the summer doing songwriting and recording. So they've actually recorded a song around our campaign and planned a flash mob dance that's actually going to be out there when we have our Bridges to Prosperity. But I love the idea of sort of shifting, whether it's power or not, is that those youth know the dance, and they're actually going to be training and teaching it to like the dance teams at the high school so that it can be continued within the school building. So we're kind of getting the youth where they're at, exposed to activities that connect into the bigger picture.
I love it. That is great. Well, and you also mentioned that you're involving youth and you're involving young people in menu development at schools too. Mm-hmm. So there's a lot you're doing inside the schools as well.
Yeah.
That's very cool. So what I think we're going to do is wrap up the Q&A. Do you have any last words, Kim, before we move into the county health calculator?
No, I just really appreciate the opportunity to share our story and let people know if they have any questions. Just email me, and I'm be more than welcome to share any learned lessons or that I've come upon.
Oh, that's fabulous. We really appreciate you doing this with us, and it's been great to have you on. So thank you so very much, Kim.
Thank you.
We're going to move into go back to the a slide that shows our website, the roadmaps part of our website, and let's go to the county health calculator. This is the tool that we mentioned at the beginning, and about a third of you had some experience with that. If you go to the bottom of the roadmaps homepage, what you'll see on the bottom is a project showcase. And if you clicked on the project showcase, what you'll see is the county health calculator. And the county health calculator is an application that shows the impact of social factors, education and income specifically, on health. So if you clicked on that, what you would see is the home page for the calculator. And you could actually go in and click on your own county. And what we've done is we'll show you the Mason County example here. So there's sort of if you look in the middle there, almost like a slide rule, if you will. You can move back and forward on education and income to show, for education, the percent of adults with some college education, and then the percent of adults with an income that's twice the federal poverty level. And as you slide that back and forth, you can see what the impact is on, in your county, deaths per year in people with diabetes and diabetes costs. So this is a great communication tool for engaging educators and business leaders and your community in why it's so important to prioritize education and economic opportunity. And it gives you a way to talk that common language across all of the sectors. And I'm wondering if anybody would like to speak to their use of the calculator at this point in the webinar, those of you that have used it in the past. Is there anybody that would be willing to talk about how they've used it or would like to share an example? Just looking in the chat box here. Okay. Well, if you think of anything that you'd like to share after the webinar, please feel free to contact us. We definitely would like to make that part of connecting people. But this calculator is something I hear when people call us. I'll talk with folks about they really don't know how to communicate that picture, that graphic of the multiple determinants of social, of health, and how do you do that to business leaders? Well, this is the results, and this really will make an impact with them, as well as healthcare folks. So,
Jim, let's give folks a few moments. I know Michael chimed in and said that he would share a little bit, but he needs to type it out. So let's give him a few
Oh,
minutes.
great. Okay. Michael, thank you.
Thoughts about how they've used this tool.
That would be awesome.
Move through some of the other slides and come back to it.
Great, great. Well, I'll come back to the essential question that we have, and that was how can we build true partnerships with education, folks in education that will lead to policy and systems changes. And we hope we've answered that, but also gone beyond that. I think Kim helped paint for us a picture of going beyond just connecting with educators. It's also connecting with business leaders and connecting with the community, pediatricians and so forth, and engaging youth. So it's a great example, and Kim's story, Mason Matters, is written up, and Karen has chatted out that link. We also want to invite you to stay connected with us, of course, if you want to follow our county-by-county blog. We're doing more and more blogging on stories, and, you know, for example, Michael, if you've got a story to share, we'd love to share that with Matthew Call here. This is a journalist that is now on our team, and he's doing a lot of blogging on our site, and we'd love to share your story there. So please do get in touch with us about that. You can follow us on Twitter, and you can like us on Facebook, and you can, of course, I suspect all of you that are on the webinar, subscribe to our e-newsletter. So do we have some more to share about the calculator?
Yes.
Yes. Okay.
All right. So,
is that chatted to all of us or just to us?
I don't know if it's just to us, so
okay.
It's something that I'll read off. So Michael is sharing that one of the things that they do in their organization is to calculate return on investment, which I know is a huge thing that people are always asking us, how do we get to return on investment? And they need to do this for their hospitals and business partners to really make the case for preventive medicine and focusing on social determinants of health instead of just reacting to illness. So I think a lot of people can really relate to that need. So they use the calculator along with some cost of illness measures to make the case for how we can improve health. And I think that's just a really great way to use the county health calculator because so many people, and this is what I often will point people to when they're thinking about how do I show a return on investment to our partners, and I think that's a great example. Thank you, Michael, for sharing that.
That's great. So we've come to the end of our webinar. As we said, this will be archived to the recording on the site along with the handouts, which Karen chatted the link to that at the beginning. And so feel free to go in and take a look at that and share this freely. We also have all of our webinars archived there on our website. And we really thank you for joining us again, Kim. You've been a wonderful guest presenter, and thank all of you as participants for joining us. And take care, and we'll see you next time. Our next partnership series is actually with business, and Kara McNulty from Target Corporation will be our guest presenter, and that is September 10th. So we're looking forward to that, and looking forward to having all of you back on our webinars. Thank you.